Good morning, everybody. Welcome to another Mancoll Minute. Hope you have a lot of great weekend plans. So we continue to get lots of really good questions, a lot of stuff about questions about body contouring, liposuction. I do a tremendous amount of that, so it's not surprising I get a lot of questions about it. Well, one of the questions that caught my eye is what kind of lipo is good if you want to use the fat that comes out for fat grafting. Now remember, fat grafting is a process where you take fat from one part of the body and you inject it and place it into another. So the common places we do that are going to be the face as a recipient site, the breast, or the buttock. And the buttock's called a Brazilian butt lift. So I will tell you, just as a general rule, we're still figuring out fat grafting, I think, from a scientific perspective. There's lots of debate about, do you take fat and do you spin it? Do you dilute it? Do you add PRP? What technique of harvesting is going to give you the most fat take? I mean, there's a whole science behind that really has come about in the last, I'm going to say, 8 to 10 years. But for the most part, the technique that I use seems to give the best results in my hands. And I think that's a key concept, because there's some people that are really, really famous that talk about, how much fat take they have. But it's in their hands, that's what you get. But other people have tried to reproduce it and they can't. So don't get caught up too much on the hype of one technique of fat grafting versus another, because I really think it's what's working for your doctor. But with that said, any technique of harvesting fat that doesn't kill the fat is a good way to harvest fat, to use it for fat grafting. So I have multiple technologies in my practice. I have smart lipo, I have Vaser lipo, I have power assisted lipo. All of them are done with the tumescent technique. I throw those words out because you'll hear about them. But I will tell you that the smart lipo actually kills fat cells. It liquefies them. I also have Renuvion, which is an energy to tighten skin, radio frequency, and it would not be one I would use prior to harvesting fat, because it also should injure fat cells. Vaser, which is ultrasound, is a great way to break up fat, make it a little easier to come out, and then have fat that is viable for fat grafting. And then finally, the power assisted, which I do the majority of my lipo cases with, is also a great way to harvest viable fat that can be used for fat grafting. I also think what is important too is, how do you put the fat back in? What technologies or techniques do you use there? Because fat grafting to the buttock has had a very high complication rate associated, if not done by a properly trained plastic surgeon. And not all plastic surgeons were trained on this, so it's one question you ask your plastic surgeon is, how many of these do you do? You hear horror stories, or you look them up online or read about them, of people that go down to Costa Rica or Miami and then they don't come back because they have, they had it done in a very dangerous way to save a few dollars. And I get the saving the money part. It's not worth risking your life for. So it's critical, not just how you take the fat out, but how you put it back in. So for me, I do the techniques that are seen as best practice: large cannulas, bent cannulas, power assisted insertion versus hand syringing. The face is a little different, but as far as the body goes. And I think these are very, very critical aspects of doing fat grafting safely. Now, as far as fat take goes, I just tell everybody 50 to 60% is pretty standard, whether it be breast or buttock, and then how you protect it afterwards probably is a big contributor to whether that's 50 or 60%, or that maybe even higher, 60 to 70%. So depending on what your goals are, we're gonna kind of put a little extra in for what we expect, knowing that it's going to shrink. Some of it will be reabsorbed so that we settle where people want to be. And then of course everybody gets the conversation about, we might have to do some extra fat grafting later if it's not quite as full as you want or as big as you want. But for the most part, my touch-up and revision rates are very low as far as having patients wish there were more in there. So hopefully that was a long-winded way to answer your question about how to fat graft or the best technique to fat graft. And for the 3 to 4 cases a week of fat grafting I do, I think I got a pretty good handle on how it's done. So if you have more questions on a personal level for how it might apply to you, happy to see you in the office, talk to you about it. Just give Teresa or Tess a call and they'll help make the appointment. Have a great weekend. Take care.